I'm Sally Masters. I had surgery with Dr. Eggert to have both knees replaced in 2018 at OSI. I had my surgery in 2018, both of them. I had both knees replaced the same year. And just a couple of years before that, I had gone to Universal Studios in Florida with my wife. And I ended up having so much pain in my knees that I ended up having to rent a motorized scooter. But it was that event that I said, I really have to dig in now and figure out how to get beyond this pain. And if that includes surgery, I'm willing to do it. I actually was scheduled for my first surgery on my first knee in late 2017 with a different doctor. And one day, one of my friends came over to the house to drop off an ice machine for me to use in recovery. She had just had both knees replaced at the same time with Dr. Eggert, literally 2 or 3 months before that. And she came leaping up to my front door with the ice machine. And I said, "Can you come in, please, and tell me about your surgeon and your surgery?" And she told me about Dr. Eggert. And I was so impressed with what my friend Patty had to share, not only about Dr. Eggert, but about his method of using the Mako robot. That information was life-changing for me. My experience with the whole program at OSI was really flawless from beginning to end. I mean, the attention was just, so personal and detailed, very caring, but yet also very professional. The recovery in, it's like I want to sing about the recovery in. Boy, what attention and care. I can't imagine anyone could get better care than you can get at the recovery in. My advice to someone trying to decide if they should have knee surgery is, first of all, I think you know when it's time. And when you know that it's time, you probably should have done it before. I really wish I had done it 10 years before. I feel like I missed out on so much life and so much activity because I waited so long. Make sure that you have a really good surgeon that you trust and know that you can rely on them to do a great job. And I personally really believe in the Mako robot. I think it does help the surgeon to be able to provide you with the most accurate experience possible.